Hello, everyone, and welcome to today's session. My name is Emily Cossack, and I'm the Knowledge Manager for the Canadian Institute of Public Safety Research and Treatment. Thank you for your patience today. We did have a few technical issues, and unfortunately, our speaker today won't be able to share her video, so we apologize for that. But we do know that it'll still be a great talk. We will be talking overworked and underappreciated, and then COVID-19 came and stayed is the topic for today. Before we get started, I just want to go through a few housekeeping items. First of all, you are in listen-only mode. That's to limit feedback and noise. Today's session is being recorded. You'll be sent a copy tomorrow, so if you missed anything, you can watch it again. Just so you know, sometimes a GoToWebinar launch window can be blocked by some organizations. If you're having trouble hearing or seeing, you may have to join by phone. We will be looking for audience questions at the end of the session, so please send us your questions through the questions box or be ready to raise your hand to ask your questions. So now I'm going to go ahead and introduce our speaker for today. Dr. Linda Duxbury is a professor at Carleton University, and we're excited to have her present today.
So I have no visual cues, so I'm hoping that I can just get started now.
You can.
Yeah, okay. And it's too bad because I even put lipstick on for this talk. But I don't know how many of you are Mac users, but Mac users doesn't like this particular system at all. And I've had problems with it before, but such is life. I'd also like to acknowledge that my co-worker on this, my PhD student, Sean Compo, is somewhere, in the void out there. And I know one of my other students, Neil Karchenk, is also on, and I'm pretty sure Rebecca Stiles. So I teach in a business school, which is not where most police researchers are situated. But for me, my area is work-life balance, stress, employee well-being, recruitment, retention, managing people effectively. And police services are a pretty fascinating group to look at, and they've got pretty big issues. I would also have to say that I've got data on all kinds of employees, and in terms of the issues you face, you're most like nurses, believe it or not. Many of you are married to nurses maybe, and you're also like teachers. In other words, these are all three professions are groups of people who went into the profession because they wanted to make a difference, because they cared about the community that they were working with, etc. And in many ways, they've been mistreated by their employer or organizations or the government in terms of expectations. So my students, so for example, Sean and Neil are both working with the Scottish Police. Rebecca is working with the Ottawa Police. I've done a lot of work with the Canadian Police Association, and I'd really like to acknowledge them. I don't know if Tom's on. For supporting work into employee well-being and really championing it. So during the pandemic, we surveyed 36,000 working Canadians. And then we also surveyed the police. I've got data on the RCMP, and I've got data twice from the Canadian Police Association. And so I'm going to give you a bunch of comparative data. The first survey that I'm going to talk about today was actually done a long time ago, but then we've got the data from the early stages of the pandemic after the second wave. And I don't know about you folks, but I've lost track of how many waves we've even got. And then the second one was done about a year later when we were in the Omicron peak, right? So we've got pretty good response rates, and the exact same data questions were used to measure well-being, etc., in both time periods. Now, I am an academic, and so, situated, we were really looking at the green, well-being, but we were also looking at employer well-being because we really want to put some cost values. Remember, I'm a business school prof, on not paying attention to this issue. So we've got stress, health, burnout, we've got absenteeism, presenteeism. We've got stressors in the work environment, setting things off to begin with. And then we've got a lot of things in the middle that actually manifest from the stressors and cause the well-being problems. And moderators are things that can make it better or worse. So we've got a lot of data on that. Now, given I've started a bit late, I'm going to go over some of this stuff fairly quickly, and then, assume that I've got an hour still. So we always situate, you need information, demographic information about who you're studying. Why? Because a lot of demographic characteristics are a pretty big predictor of well-being. Okay, so it gives us risk factors, it gives us resources, etc. So, the two samples were virtually identical in many key ways. Majority of officers that we had, male. Majority of officers, married. Majority of officers, parents. Majority of officers, not just parents, but also had elder care. And I really want to highlight this for any of you who are interested in the whole well-being issue of police officers. We're talking, there's an over-focus on child care and an under-focus on elder care. About 40% of our sample had both child care and elder care, so they were in what we would call the sandwich generation, completely overwhelmed with demands at home and pretty big demands at the workplace as well. In terms of our samples, most people were in their early 40s, and that's pretty important when we start looking at the health data later. These are young men and young women who should be in pretty good health, but many of them are not. All right, and the reason we've got younger people is because the Canadian Police Association tends to have us as members, constables, and sergeants. Most people, so it used to be that the dominant model was a male police officer with a partner at home who looked after everything. So that is not the model right now. Most of our police officers are married to somebody who's also working, and in many cases working in quite stressful jobs. So in the time one sample, most were married to essential workers who worked outside the home during the pandemic. During time two, most of the officers had a partner who worked from home during the pandemic. Okay, both samples, they considered themselves the primary breadwinner, and that's because police incomes are reasonably good. And in both time periods, 1 in 5 of the officers in the sample were married to another police officer. So if you want to know what I want to do research on, it's dual police couples, because the challenges they face are astronomical. Most people are parents, as I said before, and they did about 50% of the child care in their family, even if they were male. Both have elder care, and we're saying now elder care is the new child care. And in fact, elder care has really seen a rise in prominence as a stressor during the pandemic. We treated our elderly shamefully during the pandemic, quite frankly, in many situations. And now, of course, that's led to the children of these elderly dependents real increase in stress and worry, okay? 1 in 3 in the 2020 sample were in fact sandwich generation. So male officers have a different reality from females. Females were more likely to be married to another police officer, not have children, and assume a greater responsibility for the day-to-day responsibilities for childcare, up to about 75%. Okay, male officers, their income is hugely important to their family. We asked, a number of questions that were unique to the 2022 survey, the second COVID survey. At that time, we said, hey, have you had COVID? Have any members of your family had COVID? Well, at that point in time, 40% of them had caught COVID, and half indicated a family member had. I'm a COVID virgin. I still have not had it. I'm touching wood all over the place here, but most people that I know of now have in fact had it. We asked people in the 2022 sample to tell us the type of work they performed. Most were constables, but 1 in 5 were sergeants. 50% were patrol officers or call response officers, so front line, out there, etc. 40% were parts of specialized units, so they were detectives, guns and gangs, etc. 4% were community police officers, and 9% we couldn't classify in any one group. So I'm very interested in what causes stress, all right? Because I see far too many organizations have a tendency to say, well, let's talk about resilience. Let's talk about how people can manage once they're stressed. Let's talk about exercise. Let's talk about, but all you're doing there is putting the burden on the person who's in the extremely difficult situation to fix themselves. That's important, and I'm not saying it's not, but I like to actually look at the thing that's causing the problem and address that instead, okay? So if I've got anybody on here from the Ottawa Police Service, in 2011, I started my first research with the police and my first research with the Ottawa Police. And it's a long and involved story, but they had an extremely difficult situation within the service. The chief at the time, Vern White, said, look, I can't deal with the situation the way you want me to, but I will do a study on employee well-being with everybody in the one half of the house. So the half of the house, guns and gangs, murders, detectives, all of that side. To identify what are the key stressors. So we did focus groups, we did interviews, and we came up with 20 pretty unique stressors to police. Now, I'm not a police officer, and in 2011, I thought it would be being called to a scene where someone died, being a witness at a car accident, fearing being shot, all of the things that I was exposed to on TV that I thought made the police officer's job stressful. That's not what we found. So what did we find? We said, please think back over the last 6 months and indicate for each item the frequency with which you experience this stressor as a source of stress for you. Range from 1, hey, not a problem, to 5, I experience this daily. So anything above 3, 3.5 means this stressor is problematic for police officers at least weekly, often more, okay? So in the 2011 survey, what caused stress? Multiple competing, ever-changing work demands. I'm responsible for way too many things. When I go to my command and I say, you know, you want me to do A, B, and C, which one do you want me to do first? And they go, all of them. You know, which one can I drop? None of them. So the volume of work and the fact that you're supposed to do way too many things, way too many priorities. Police services, in my experience as a business school prof, are not great at setting priorities, you know, and that is part of the problem. As other services in the community get less and less funding, more and more has been dumped on the police service, and the expectations are you will do it all. Really also a very big source of stress, understaffed, under-resourced. I can't even go take a pee break, excuse me. I mean, there is not enough staff for breaks. There's not enough staff for meals. If somebody's away for whatever reason, we can't staff up and we all have to work extra. You know, so it's simply not enough people. Then the other ones, dealing with the court system, pressure to take on work that falls outside my mandate. I'm pressured to volunteer my free time, and the culture of policing. Something is seen to be wrong with you if you say no. You're not a good officer, you're not promotable, don't you care about the community, etc. And it's hard to ask for help even in this culture because again, you're looked down on if something's wrong with you, not that you're a smart person. So we concluded after the 2011 study that most of the stressors have less to do with the job of policing and more to do with resourcing, the culture, and how officers are being managed, and the fact that there's way too many priorities and not enough staff. At that point in time, we said, you got a choice, reduce priorities or hire more staff, because otherwise, and in 2011, we said the situation is not sustainable. Well, how many of you are in the audience going, well, they listened to her and we reduced our priorities and we got more staff? Absolutely not, as you're going to see. So after consultation with the Canadian Police Association, we included these 28 measures plus a few extras depending on things that we had noticed that had happened in the environment and that the police officers we worked with thought would make a difference. So here's the 2011, 2020 and 2021 data. Okay, the higher the score, the greater the number of officers who indicated that this was a really major source of stress. I'm not giving you everything, but 3.5 and above means that this was a source of stress, you know, several times a week or daily for police officers in the sample. And we had 1,000 in both time periods. If there's stars there, it means that this is increasing over time as a stressor. So what is the number one stressor right now? Negative images of the police in the news, okay? But hey, that one, not enough officers to do the work required. That has gone up over time, not down. The amount of time I spend in administrative work, phone calls, typing, rekeying, forms, that's gone up over time as well. Very interesting. The cases I deal with are more complex in the past than in the past and requires a much greater effort. Look at the increase in that one. You know, and that's because a case is not a case, but that's not how police services typically assign work. Sheer volume, how the police are being portrayed in the media, managing expectations of the public. Again, we get these competing simultaneous demands. I don't feel the organization has my back. That was only included in 2022. It was a smart inclusion because it's a pretty major stressor for a lot of the officers that we sampled. Not enough people to take my breaks. Culture again. Public discussions on defunding the police. Too many ever-changing number one priorities. It hasn't gone away. Meeting demands when people are away. Hasn't gone away. Skilled workers. Hasn't gone away. You know, I worry that there'll be a public complaint about something I did and the service won't support me. Same indicator as, you know, the service doesn't have my back, and public protests on the police. So changes in stressors over time. So first of all, 66% of the cases, the extent to which a stressor had a negative impact on officer well-being increased significantly over time. Okay, so things are going, we're talking a lot about police well-being, but the indicators are going in the wrong direction. So these are the ones that increased over time between 2020 and 21. And these are fairly, like, look at this one, managing my relationships with the media and the public. I'm on camera all the time. And this is incredibly stressful. And the stress over time is becoming chronic. The cases I deal with are more complex and require greater effort. So my service doesn't seem to realize that, okay? Rather than a case is a case. No, it's not, but that's not what is happening out there. Not enough people to take breaks, not enough people to do the amount of work that's required. Paperwork, administrative work going up, not down. And, you know, that one seems to me to be relatively easy to address if we have the will to do it. And public protests against the police in Canada, again, going up. Culture, again, volume of work, people away, shortage of staff. None of these things, these are all the same things that we saw in 2011, and they're increasing and they're becoming more problematic. So the extent to which the other stressors were problematic didn't change. In 2 cases, we couldn't observe any changes because we only put it in the 2022 survey. From now on, we're going to make sure that we include this kind of stuff in our survey. So the other 2 cases, the results imply that Canadian Police Services haven't done anything really to address what both the 20 and 22 data show to be a problem. Negative police images of police in the news, public discussions about defunding. So those are major sources of stress. They're not new sources of stress. They are sources of stress if we combine it with, I don't feel my services got my back, and if I do something wrong, I really worry that there's going to be a public complaint and I'm going to be left hung out to dry. Those are all painting a pretty difficult picture of the environment governing police today and how people feel supported, okay? Other analysis showed that how the stressors grouped together completely have changed over time. So in the 2011 sample, and Sean's here, he can correct me, but please don't, Sean, because I don't have enough time. We had these 5 factors. The 2022 data, we've got really only 2 main groups of stressors. This multiple competing demands teamed with understaffing and under-resourcing. So that's what I say, either prioritize and get rid of some of the demands or staff up, but don't continue to have both of these stressors operating at the same time. And the negative image of the police in the news. So here we have the percent of the people in the 2022 sample recording low, moderate, and high levels of stress due to ever competing demands and understaffing. So you can see that's 40% of the people say, you know, this is a very high predictor of stress. Only 1 in 4 go, hey, not my issue. But look at the issue of the negative image of the police in the news. It's a major stressor. It's not being talked about. It's not being dealt with. It's particularly a stressor for my frontline officers who have to deal with the public. Changes in how the public view the police are now a major source of stress. If we go back, you can see close to 50%, it's a major source of stress, all right? So what is in that grouping? Public discussions on defunding the police, how the police are being portrayed in the media. It makes it really hard for me to do my job. Negative images of the police in the news, public protests, managing relationships, being on camera. I worry about a public complaint. And we've also done, I don't know, I should have acknowledged Andre, one of my postdocs, is also doing a lot of work on police stress. And we've done interview research with police here on their stressors and how they changed over time during the pandemic. What we found, and you guys all know of it, but you know, people are talking about FIDO calls. What is the result of all this? And the fact that I don't feel anybody's got my back. People are just saying, fuck it and drive on. And they're not stopping because, you know, the problems, if they do stop, and the stresses, if they do stop, are preventing them from, you know, proactively doing certain things. So officer stress has more to do with under-resourcing, understaffing the culture, you know, and they haven't been addressed. So I don't really change my conclusions here. When we talk about the problem for police officers, it's about the workload, stupid. And you can deal with workload 2 ways. You can get rid of some of the jobs that you're holding them accountable for. US leaders, if I've got any police leaders here, can start saying no to community tasks, saying, hey, you want to keep defunding, that means that this, and this can no longer be done. Or you can staff up. Many of the stressors, they have more to do with how police officers are being portrayed in the media, job creep, culture, and workloads. And I said in 2020, it's going to be really hard to recruit and retain police officers if these stressors are not addressed. I said it in 2011 too. And I was told, don't you worry your cute little head about it, Linda. You can't see me, but that's what they said. People will always want to be police. We've always had an overabundance. Now I'm kind of going, hey, how's that working out for you now? How is that working out for you now? So it's time to change the conversation. If we want to deal with police mental health, we have to talk about the costs of not doing this in terms of employee well-being, in terms of the police's ability to deliver necessary services to the communities they work in. The current situation is absolutely not sustainable. We're starting to see cracks in the system. You should be calculating the cost of accommodations and accommodated leaves and prescription drugs. That is a real cost your employer is actually paying. And in fact, I'll bet you anything that cost is higher than the cost of actually bringing on new officers. But why don't they do that? Because it means they're going to have a confrontation with some parts of the community who are actually calling for a completely different solution, which is defund the police. Time is I'm glad you can't see me. But time is a stressor. When we look at and we ask officers, how would you like to spend your time versus how do you spend your time? Officers really want to balance their time between enforcement and prevention. What they're spending time on, if you look, they're, more than half are spending their time way more than they want totally on enforcement. Community wants prevention. Police officers want prevention. But if you don't have enough officers on the ground, then unfortunately, you're required to deal with the enforcement dimension of the job. And the prevention piece, which can actually reduce the workload in the long term, is the thing that isn't done. Demands, these are the demands that are essentially unchanged over time. So we asked our people, what percent of you spend time in these activities? So they're spending a lot of time in enforcement and prevention. Dealing with custody is a big one. Waiting for court, again, a bad use of officers' time. Where has time increased over time? Writing reports, reviewing reports, dealing with mental health in the community. Look at this. And even when I did it in 2011, it was 35% of the officers spent time each week dealing with mental health. That's crept up to 48%, up to 66% right now. That's time, and one of my PhD students looked at time spent in Emerge and costed that out. When the typical wait time in Emerge is about 4 hours. And now I don't know about across the community, but I know in Ottawa, we're having trouble offloading in emergency rooms. I bet you it's gone up even again. That's again a bad use of officers' time. Engaging with the community has gone up. Working at home outside of regular office hours, that's gone up as well, because you can't get all kinds of things like paperwork done on time. The only one that went down is dealing with COVID-related issues, okay? Probably because police just were not expected to do that by the time we rolled around to November 2022. Mean hours in each activity, you can see the big ones, and again, it decreased. Enforcement decreased, crime prevention decreased, hours in mental health activities, it increased. Writing reports stayed the same. Engaging with the community, all of these ones, they're about the same, by the way, statistically. We asked, how often do you have time for an uninterrupted break at work? almost half of our sample of 1,000 officers in the 22 data said, no, I don't have time. I don't have time for lunch. I don't have time for a break. I don't even have time to take a biological break. Now, in other sectors, that would be grieved. But here, it's part of the job. 1 in 4 only have time for a break regularly. Again, you know, you need to be able to get away from the job to actually reset, you know, and that's simply not there. So the conclusions with respect to demands, hey, you guys work really hard. Even if we take the mental health job away from you, you're still understaffed and under-resourced. Many officers can't count on time for a break when at work. Many services couldn't get their work done if the officers didn't work through their break and donate their time to the service and the community, but that's not being talked about. A lot of the work being done by the officers is only peripherally related to their job. It's increased over time as government funding to other social service supports has declined. And to me, it's no wonder that we find that a major source of stressor is discussions on defunding. Officers are going, hello, you know, I can't get it all done now. What happens if we're defunded? So we looked at, we go back, this is the middle piece of the model, okay? And this is strains. So all of those stressors cause strain. Strain damages well-being, okay? So we looked at work stress. That's the extent to which the job itself is stressful. Okay, 60% of you folks say my job is incredibly stressful, and it's to do with those other factors, not as much to do with workloads and work demands, etc. Only 1 in 10 of my officers say, hey, my job isn't that stressful. And so we wonder why accommodations have gone up. We wonder why it's becoming more challenging to recruit. We wonder why officers are not volunteering for promotions. Hello, this is probably part of the reason. We look at overload. How overloaded are you by everything that you have to do in the job? All right, that has increased over time. It was 1 in 4 have very high levels. So overload, work role overload is I'm overwhelmed and by everything I have to do at work. I just don't have enough time to do all the tasks that I'm supposed to do. It went from 1 in 4 high to 1 in 3 high. So again, we're seeing an increase. Work interferes with family. That's a bit. Remember about the culture. You're expected to put work first. That's part of your job. It's been an issue for officers for as long as I've been studying the police. So that's 2 decades. And it's something, 2011, no, that's 1 decade. Sorry, my math is not good. And again, we wonder why the pandemic, by the way, from my data with the 36,000, balance has become way more important to people, you know, because they've had a chance to really look at their lives and figure out what's important, and family's important. We're starting to see, you know, part of this quiet quitting, part of this retirement, just quitting work completely is due to an inability to balance, and police officers are not poster children for good work-life balance, but it's becoming more problematic now than it was before. Family interferes with work. Increased low, medium, and high. It increased during the pandemic. I think I actually put this the wrong way. So work interferes with family, substantive issue for half the officers in our sample. It's consistent with the culture of policing, which is if you say no and you don't volunteer your free time for the good of the service in the community, something's wrong with you. 60% report high job stress. It's not surprising since the services haven't really addressed the issues that are contributing to job stress for the last several decades. High levels of work interferes with family and job stress. They're now a systemic issue for police services. you know, they're not new, but they've been increasing over time. And family interferes with work is particularly a problem for my female officers. We looked at well-being by looking at a number of different indicators. Mostly we looked at indicators of physical and mental health, perceived stress and burnout. And in this case, we used indicators from the psychology and psychiatric literature. So we just didn't go, hey, are you stressed? We actually used indicators that allow us to compare the police officers' well-being to the well-being of other types of employees. We measured employer well-being in terms of absenteeism and presenteeism. So this is pretty interesting. In terms of perceived stress, we went from 28% with high levels of perceived stress to 34%. So perceived stress, and we use the PSS, the perceived stress scale, to measure perceived stress. What is also as interesting to me is no one has low stress. No one's doing good, okay? You've either got moderate levels of stress and high levels of stress. What is also interesting to me is this is a sample of males who tend to underreport stress, okay? So probably the stress scores are somewhat higher than we're seeing here. So burnout is when you hit a wall. Burnout is you just can't take somebody off a committee and expect them to be better. Burnout comes from chronic stress. And when you've got the same things that are causing problems for years and an extended period of time, you become overwhelmed, frustrated, and you just give up in many ways. You just stop caring about your community, about your job, about your colleagues to protect yourself. So we've already seen that the levels, the chronic stressors haven't really changed. Workload hasn't got better. People can't get away from their job because they can't even take a break. So what we're seeing here is burnout. I was concerned in 2020 when 1 in 10 had high levels of burnout. We're now at 1 in 5. And we've got a significant number of people, 1 in 4 at 2020 were at risk, and now it's 1 in 3. The number of people who are doing just fine is now only about half of the workforce, if we can use our sample to generalize. And these are the people who had enough time to actually fill out the survey. So I'd love to have a bigger pool. Perceived physical health, okay? So 1 in 4 people are saying their health is fair or poor. Remember, and this is, you know, only 1 in 3 is saying their health is very good to excellent. These are police officers, most of whom are men, most of whom are in their 30s or early 40s. I would not expect that their health, them to rate their own health as poor. But again, you know, it's consistent with the rest of the data. Now, during the pandemic, I started actually measuring a thing called, I started measuring emotions. And emotions actually capture part of your brain, and they really impact decision making. So in terms of what we did, this is just academic 101 again. You can classify emotions as being high levels of arousal or low, and they can be negative emotions or positive emotions. So negative emotions are anger, frustrations, tense, I'm worried, etc. Whereas negative but low arousal is depressed, bored, tired. So if we look at our police officers and the emotions, what we see is that people either have active negative emotions, 1 in 3, or passive negative emotions. So half of the people are reporting negative emotions. What is the dominant emotion in police services right now? Number 1, anger. Oh, pardon me, number 1 is frustration. Number 2, so this is just a word map that we created using the frequency with which people wrote these words down. They're frustrated, they're angry, they're unmotivated. I've got some people who are happy. I've got a lot of people who are sad, lonely. I've got some people who are thankful, calm, but look at, I mean, outrage is little, but it's there. This is not a positive picture. And the problem is if we go back here, if you're in this quadrant, actually, it can negatively impact your ability to make decisions in the moment. And what is key to the job of police? Making pretty high impact decisions in the moment is your job all of the time. But emotions, and this will blow some of your minds away, but emotions dominate logic. You know, so if you're very emotional, you can actually make illogical decisions. So it's important that we've got there. So we looked at absenteeism, and we looked at it from a whole bunch of different things. How often were you absent in the last 6 months because of physical health, family issues, emotional and mental fatigue? In other words, I just took work off because I couldn't face going in, and physical fatigue. So if we look here, the health problems, absenteeism due to physical health has gone up. And that's consistent with the fact that 1 in 4 of your people say, I'm not in good health right now. Family problems have gone up slightly, but I really want you to see that 1 in 3 officers are regularly taking time off due to emotional and mental fatigue. So it's again a big indicator of the fact that the job and all of these competing multiple demands, and the fact that the community that they think they're servicing and that they're motivated to service doesn't appreciate them, and the fact that they feel that if they do anything wrong, they'll be hung out to dry in the media and the press. The focus is on what they're doing wrong, not what they're doing right. It's taking a toll. And so is the physical health, means that they are going away as well. And the problem is, and I meant to mention this when we got to COVID, anytime anybody is exposed to COVID or feels they have COVID, they would miss on average 9 days of work because of COVID. So, and we're already understaffed, you know, so where are we going to get the officers to do these jobs? Because we have legal requirements to have certain number of people on the road, etc. at the time. Presenteeism actually costs employers more than absenteeism. So look at this. This has gone up over time. What we had, I thought the situation in 2011 was appalling, but then I saw the situation in 2022. So in 2020, approximately 1 in 3 came to work when they were physically unwell or mentally unwell. In 2022, 50% of my 1,000 officers in my sample indicated they came into work even though they knew they shouldn't. And that's because of the culture. That's because they really care about their colleagues. And if they don't come in, they know their colleagues are going to have to do the work because they are not there. So it's a vicious cycle right now. Use of prescription medicine. Again, I would like to really start working with some services to put the cost value on this and show the cost of absenteeism, presenteeism, and prescription drug use is probably higher than the cost of hiring new workers, okay? So 1 in 4 are taking prescription medicine to help them sleep. And about 1 in 5 are taking it for anxiety, depression, chronic pain, and 1 in 10 reduced blood pressure. These are all symptoms or indicators of a mentally unwell service. And what you've got to consider is any mistakes these officers made, nobody's going to go, well, that's because they're overworked and under-resourced and too much is being asked of them. Instead, we're going to just all pile onto them and say, you know, these officers, we're going to attribute motives that are not good. Okay, so I feel horrible for police officers and want to do something to change the discussion. A substantive number of officers' well-being has declined over time. A substantial number of officers are either in poor health or at risk when it comes to their mental health and well-being. These are just the data, that actually support that really strong statement on my part, but I think I'm very comfortable making that statement. For me, the data on officer burnout is particularly concerning. Manifests itself when chronic stress is not attended to. Well, hello, we haven't attended to it for well over a decade, and the chickens are coming home to roost. Pandemic is likely to exacerbate issues with chronic stress rather than alleviate them. It's a function of experience at work, not at home. We also measured burnout at home. Only 3% have chronic burnout at home, and they tended to be females. The consequences of burnout are profound: fatigue, alcohol consumption, poor physical health, heart problems, professional mistakes, and accommodations. And we're seeing all of those things. We're seeing them in our data, and we're seeing them in your data. So it's not like you can continue to do this, at no cost. There absolutely is a cost. Officers, either not encouraged or unable to take time off work. The number who are coming into work when they're mentally unwell. We talk about the culture of policing. We talk about peer support. We talk about all these things, but my data is saying it's not making that much of a difference. When they go into work on average 16 times over a course of a 6-month period, our data would say, when they themselves recognize they're mentally unwell. All right. So we have to start looking at the causal factors, which are the multiple competing priorities, the workload, insufficient staff, and how they're being treated within the community and in the media, and the fact that they're not being supported, and they feel they don't have control over what they are being asked to do. Okay, so these findings: work demands placed on Canadian police officers. By the way, we have also got data on our CMP officers from the same time period. We've also got data from Scott. These are not unique to us, though I would say, definitely the Canadian data is worse than the Scottish data for sure. So many officers are reacting emotionally, and the most common reactions are negative feelings of frustration, 83%, uncertainty and anger. Given the age and gender and job type, surprised to find that people are 1 in 4 are in poor health. So, and that's actually the same number who are taking these prescription drugs. So it would seem that mental strain and the demands they face at work are taking their toll. In 2020, 1 in 3 officers missed work due to COVID. Each officer missed 8 days. Question then becomes, given issues with respect to understaffing, how can police services manage these higher levels of absenteeism without negatively impacting the well-being of their officers who need to actually work on their days off, attend court calls, etc. So what we're finding is, because we're not dealing with it, it's like you throw a pebble in the pond and the waves are going out now. The more officers we've got on accommodation in a particular service, the more this is going to be a problem. So we have to start dealing with this. And I'm suggesting that the place we have to do is at the stressor end, where we've got the data and it actually clearly is a cry for help, and it clearly shows where the things have to be addressed. Police services, the CPA has been incredibly supportive, as has the Police Federation from the RCMP. But I'm not being asked to speak by the chiefs. I'm not being asked to speak by different services. I'm not being asked to show them the data and what do we need to do. And I'm not seeing action where it might make a difference. Okay. So for the past decades, they've had to deal with the stress of a difficult job. They've had to deal with a severe lack of resources. They need to do the job. They have to deal with social change that negatively impacts how they're viewed and their ability to do the job. They have to deal with the fact that no one, politicians, police executives, community, can agree on what are the priorities and where they're spending their time, which means when nothing is a priority, everything is a priority. And we're seeing the impact of that in the data. Our data suggests that over time, this has eroded the resilience of many police officers. So I know that Neil is here. I know that Sean is here. We are looking at things through what we call a greedy organizational lens. So greedy organizations, the priesthood is a greedy organization. Police, the military is a greedy organization. And a greedy organization has a culture where you're socialized into the culture and expected, nothing can be more important than your job as a police officer. And if it is, something is wrong with you. So I like this quote: the scandal isn't greed in the not-for-profit sector. The scandal is underinvestment in our organizations. We're just not ready anymore. So they're saying hold police accountable, but the problem is police are accountable. Police have to be funded, and we need to put the leadership accountable. So what is a greedy organization? The extent to which you agree that work should be the primary priority, more than family. The only way to advance is to keep non-work matters out of the workplace. Individuals who take time off work to attend to personal matters or don't come in because they're sick, they're not committed. They're not worthy. The most productive employees are those who put their work before their family. And the ideal employee is one who's available 24/7. So if you're going check, 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 that's my service. Your service is a greedy organization. 50% of the officers who took the 2022 survey agreed absolutely with all of those statements. Only 1 in 5 disagreed. So for many, that is the culture that they're being exposed to. We also looked at in the 2022 survey the extent to which officers felt supported by the service. Thank you, Tom, for suggesting that, and their leaders. So I feel supported when I'm dealing with family issues. I feel valued. Senior leadership cares about health and safety. I feel supported when I'm dealing with challenges. I'm satisfied with my support. And there's a process to intervene if somebody feels distress. That factored into 2 things. My organization offers support from the service and support from the police services board and the community. So the community where I work and the politicians support the work of the police. And decisions are being made by politicians and police leadership to enhance public safety. So what did we find? Well, first of all, the extent to which they feel supported by the service, that's pretty bad. Only 1 in 5, well, not even that, report high levels of support by their service. 40%, I don't feel the love or the support, and 43% moderate support. But hey, that looks good compared to the extent to which officers feel supported by the politicians. 66% say, no, police service board, politicians, they don't support my work. And if, that's very demoralizing too, isn't it? How do you push back when those who can make a difference, you feel that those who can make a difference don't support you? So I've talked about as quickly as I can. So my main takeaways here: First of all, frontline police officers. And by the way, it's interesting, my experience is the sergeants are the rock on which the service is built. And many of my sergeants are also experiencing these exact same stressors as the frontline police officers. We don't really have much data on those above the rank of sergeant, staff sergeant. Stressors have less to do with their job. It's culture, it's resourcing, it's lack of leadership and support, it's the political landscape, and it's inertia. Hello. But I teach change. I teach it at the MBA and PhD level. And you know what? Inertia will take a big beating and a big hit because of the pandemic. You're going to have to start dealing with it now, because if you don't, we're starting to see, you know, in Ontario, we just had, even though the province said, hey, we're taking away your right to strike because of the Constitution, they said, well, we're not going to call it a strike, then we'll call it a protest and we're walking out. You're going to see, we've never seen, we can't get enough people to work in restaurants. We can't get enough people to drive Uber. Like, people are really at a key moment in terms of their lives and in terms of reconsidering what's important. So the service is going to have to deal with this. It's not sustainable in ever so many ways. You know, what takes up their time? Writing and mental health calls. You know, they want to spend time in prevention. They're going from call to call to call and responding to the radio, etc. You know, many officers work through breaks, forced to work overtime, etc. They can benefit from time away from work, but their own work ethic and the lack of choice, if not them, who? And they like their colleagues. And the culture, greedy organization, makes it challenging for them to do what they need to do to improve either their mental health or their physical health. Police services have to place a much higher priority on identifying a hierarchy of policing priorities and saying to communities, you can't have, you know, you can't have gold-plated service on a Walmart budget. If you're going to give us a Walmart budget, you can't get, you know, everything anymore. We have to engage in discussions on what it means to be a police officer in Canada today, determine police priorities. Leadership has to actually start changing the media dialogue. Rather than highlighting and jumping in there when something goes wrong, they have to be focusing on defending people and saying, not so fast here, because it's so demoralizing. Speak up, defend their officers, challenge the rhetoric out there. Start showing data to show that this is absolutely not true. A really huge thank you to Tom, a huge thank you to Sean for doing all the hard work on administering the survey and doing the data analysis, the services that participated. Happy to work with you in any way that I can moving forward, but really want to focus on the priority, workload, rhetoric, you know, and the stressor end more than anything else. So, thank you.
All right, I just want to thank Dr. Duxbury for being here with us today and sharing this incredible research, this really interesting information that you're right, I don't think it gets a lot of play normally. Now I know we are a few minutes over. Would you be willing to, there's just one question that's outstanding somebody wanted to ask. Would you be willing to answer that for us?
Absolutely. I mean, we started late, so.
We did, yeah.
So I'm happy to stay for 10:15 if people want to stay till say quarter after.
Perfect. All right, so if anybody else has any questions, be sure to submit them. The one that I do want to ask, though, that's sitting here is, have you thought about using biological measures of stress, like cortisol in the hair, for example, to compare to your perceived measures of stress?
That would be lovely to do, but let me tell you that police officers are really already overworked and have time at a shortage. even to get a good survey sample is difficult. You would have to actually, you know, and I fully believe in biological measures, but the time commitment from the officers is much higher than that. But the measures that I use for stress and burnout, by the way, are actually linked to, in the psychological literature, to cortisol, et cetera, et cetera. So you use those as benchmark indicators. But if anybody wants to do a study, and they can get those officers involved, but that's the challenge.
For sure. So you did list a few recommendations there at the end. Is there like one recommendation that you think is a great place for organizations to start if they are looking at what they're considering as limited budgets? Is there something that really stood out to you based on the research that was like, this is a good place to start?
Start saying no. You're doing ridiculous things. You're doing everything. And there's no cost to the government when you continue to do everything. Do you know what I mean? So if services start saying, we don't have the resources to do this, then, and they stick to it, then that's the only way of, you know, of getting change here, I think, because workload is one of the fundamental issues.
Perfect. Okay, so those are the questions that we have right now. And I know that for some people, they had to kind of go because they only had their certain amount of time too. But I do want to thank everybody that was still with us here today. And I appreciate you all coming. There will be a quick survey at the end of the town hall. So I hope you'll take a moment to complete it. We do host these monthly town halls on topics that are specific for public safety personnel. So if there's something you want to learn more about, let us know in the survey. Next town hall is on December 1st, and it is offered in partnership with the Family Matters Research Group. And the focus of the session will be on the new PSPNet Families Wellness Hub. So we hope you'll consider joining us for that. Again, I want to thank you so much, Dr. Duxbury, especially working through the technical difficulties to give us a really great presentation with wonderful information.